This recording will go over leukemia. Leukemia is a cancer of the bone marrow where blood cells are made. Instead of producing healthy, functional white blood cells, the body produces immature, non-functional cells. And these cells overcrowd the bone marrow, so we don't just have problems with our non-functional white blood cells, but it affects the other cells made in the bone marrow, including red blood cells and platelets. It leads to something called pancytopenia. Pan meaning everything, and then the everything we're talking about are the blood cells that are made in the bone marrow. So red blood cells, white blood cells, and platelets are all affected by this. So if you can remember one thing about leukemia, remember that it's a bone marrow failure. And while we focus on how leukemia affects white blood cells, it also affects red blood cells and platelets as well. Because of the overcrowding with the immature non-functional white blood cells, the red blood cells and platelets aren't produced properly either. With low red blood cells, we'll see anemia and fatigue. With low platelets, the patient's at an increased risk for bleeding. And with decreased functional white blood cells, the white blood cell count might be really high, but still those white blood cells don't work properly. Or you could see the white blood cell count low or normal, but regardless, they're non-functional white blood cells, and that leads to an increased risk for infection. So a big concept is that this bone marrow failure leads to pancytopenia. The red blood cells, platelets, and white blood cells can't do their job, and that's the root of the complications and the signs and symptoms we'll see in the patient. Most symptoms of leukemia come back to pancytopenia, so organize your brain that way when thinking about these signs and symptoms. First, we have low red blood cells, which lead to anemia. Think about fatigue, pallor, shortness of breath, tachycardia, classic anemia signs. Next, we have low white blood cells or low functional white blood cells. So even if a count's high, they're not working well. So we'll be watching for fever. That's a red flag for patients with leukemia, even if it's just a slight increase in temperature. Watch for signs and symptoms of infection. Sometimes the signs and symptoms of infection aren't as loud as they normally are because the body can't mount an immune response. So they might be more subtle signs and symptoms. Low platelets puts the patient at risk for bleeding. Look for petechia, ecchymosis, bleeding of the gums, orthostatic hypotension because of fluid volume loss are things we want to watch for. Other findings can include bone pain, joint pain and swelling, splenomegaly or an enlargement of the spleen. Liver could become enlarged as well. Anorexia, weight loss, hematuria are things we might see as well. Labs can be tricky with leukemia because the white blood cell count may be high, could be low or normal as well. But remember, the white blood cells aren't functional. So even if the white blood cell count is high, it's not going to be effective at fighting off infection. You will also see low red blood cell and low platelet count with leukemia as well. Other tests that you might want to peek at include the H&H, coagulation studies, and they can also do a chromosome analysis to get information about the type of leukemia. The bone marrow biopsy is the gold standard for diagnosis. It's the most definitive test that we're going to use, and the bone marrow, while the labs suggest what might be going on with the patient, the bone marrow biopsy is going to give that actual diagnosis and confirm the diagnosis. Next up, infection prevention with the patient with leukemia. This is a priority, a number one priority, because patients with leukemia, their immune system isn't working properly. So infection prevention is a priority. Some things to think about. A neutropenic fever is considered an emergency. So if my immune system isn't up to par, but I'm still mounting a fever, even if it's just a little change in temperature or a low-grade fever, that's something that's of big concern. So a temperature of 100.4 in a neutropenic patient is considered a medical emergency. And we're going to start antibiotics immediately and not wait for cultures to come back. A temperature elevation of even just 1 degree Fahrenheit above baseline can be indicative of an infection in a patient with reduced immunity. So we'd want to report changes like that to the provider, even though normally a 1 degree change might not be something that's reported right away. But remember, your patient's immune system isn't working properly. So maybe if they did have a healthy immune system, that temperature would have really spiked. But since their body can't mount that response, just little changes we need to report. Neutropenic precautions include putting the patient in a private room, making sure that we're gowning, mask, and PPE, not having fresh flowers or plants in the room, no raw foods. Some resources will say make sure that you're washing raw fruits and vegetables. Others are saying just avoid it. They need to be cooked to ensure that the patient doesn't become sick from it. Monitor temps closely, monitor CBC, watch for signs of infection. They may be subtle. And of course, strict hand hygiene. So while the infection prevention precautions for the neutropenic patient that we just talked about address the non-functional white blood cells, we also have to remember the patient's red blood cells and platelets are going to be low. So in terms of platelets, we'll be instituting bleeding precautions. So we know that the patient's at increased risk for bleeding. How can we take care of them? We're going to avoid IM injections or avoid anything that could cause bleeding. We want to advise the patient to use a soft toothbrush to help protect the gums, which will be likely to bleed as those platelets get low. We're going to monitor the platelets counts closely and watch for any evidence of bleeding, petechia, bruising, those bleeding gums. In terms of red blood cells being low, we're worried about anemia and the signs and symptoms that come along with that, and fatigue's a big one. So we want to be sure that we're thinking about energy conservation for the patient, balancing activity with rest, giving oxygen if needed, prioritizing energy conservation, and monitoring H&H and transfusing blood products if needed as ordered. A new term for you might be nadir. That means it's the period of greatest bone marrow suppression for the patient. So a lot of times the leukemia patient's medications and the timing of them will be balanced so that the nadir isn't at the same time for all the medications. So we don't want to totally wipe out all of their bone marrow and all the cells that's being produced there. So it's a delicate little balance and a little dance. But the nadir can be dangerous, right? Because if we take that bone marrow, if we suppress it too much, then we're not getting any healthy cells created. The purpose of therapy is to achieve a rapid, complete remission of all disease symptoms by killing as many cancer cells as possible. And there's really a three-step process for treatment. The first one is induction. So with induction treatment, the goal is remission. So we're going to kill as many leukemia cells as possible to get the patient into remission with induction. The second phase is consolidation. Consolidation, you can think of it as cleaning up any remaining disease that might have missed the first treatment. So eliminating residual disease after remission. And lastly would be maintenance. So that would be medications the patient's taking long-term to prevent relapse of the cancer. So in terms of the three steps here, we're going to destroy the leukemia cells. We're going to do consolidation to make sure we didn't miss anything after the patient's has achieved remission. And then we're going to have maintenance meds to prevent relapse. There are some different approaches that can be taken for leukemia treatment. First one's targeted therapy. That's a very precise treatment that targets specific cancer cells markers specifically. Also, we can use immunotherapy, which boosts the immune system to fight cancer. Stem cell transplant replaces the diseased bone marrow and can be a cure. And also supportive care, such as transfusion and antibiotics. It's a huge part of nursing care. Even if we can't cure what's going on with the patient, we can support the patient and treat it aggressively. Just a reminder that chemo doesn't just kill cancer cells, it affects normal cells too. So we're going to see GI effects, nausea, vomiting, mucositis. So we want to make sure we're administering antiemetics as ordered, and oral care is key. Patients can experience alopecia or hair loss depending on the medications used, so prepare the patient emotionally. Remember, it's temporary, but they might want to explore their options until treatment's over and hair regrows. And then the biggie, immunosuppression. We'll have an even worse infection risk, so we'll want to double down on precautions for this patient. We want to be monitoring for precaution or for complications. So these are things where you're going to drop everything situations. So the first one is a leukemia patient with a fever. Neutropenic fever, remember, Starts at 100.4, it's considered an emergency. Low platelets, platelets less than 20,000 and active bleeding, medical emergency. Tumor lysis syndrome, if you remember that, that tells us our treatment's working. It's killing those cancer cells, but it's also releasing everything inside the cell into circulation. Biggies, potassium, so you got hyperkalemia, and uric acid, so you have hyperuricemia. So watch for renal failure as your kidneys try to deal with all that extra waste product. So to wrap it up for you, leukemia, too many useless white blood cells, but it's also going to decrease red blood cells and platelets. Infection is a big priority that we're watching for, as well as bleeding. And then you got your signs and symptoms of anemia because of the low red blood cells. Infections, the non-functional white blood cells, bleedings, the low platelets. The most definitive test for leukemia is going to be the bone marrow biopsy. And remember, in a leukemia patient, fever is always treated as an emergency.